All right, welcome back. All right, so new for 2024, I'm gonna start a new kind of lecture series, and it's about everything you know about plastic surgery, pros, cons, tips, a little bit what we do and how we do things. So I'm all about education, and you know where to get that education is from me. You always wanna go for a board-certified plastic surgeon as always to get the best information. So topic for today, we are gonna do 5 recent innovations in plastic surgery. And I think this is a huge topic actually, and I'm trying to limit to the top 5 that kind of come off my top of my head, and we'll run through these real quick. So we're gonna kind of go through some aspects of plastic surgery that maybe you guys know, maybe you guys don't. But the first one for me is breast implants. So breast implants have been around for decades and decades and decades. I like to tell my patients who are interested in breast augmentation, it's like the iPhone, just keeps getting better. I would say their current generation of implants, these implants they're very simple structures, really, engineering-wise. There's a silicone bag, and then what's inside can be different. It can be water, or it can be a silicone gel. So I would say now, at least in the United States, and I would say mostly Europe, the silicone products are dominant as far as breast augmentation. It's the number 2 most common procedure in the United States. Has very high satisfaction outcomes, long-lasting results. These implants, if you just leave them alone, they're going to last you decades, and that is the honest truth, especially with the newer generation of implants. But the silicone implant specifically, now we have so much more control. I mean, each of the vendors in the United States, we have Centra, Mentor, and Allergan. They have a huge catalog of implants. They come in different, basically, profiles, shapes. They have anatomic, round. I would say 99% of the women who choose augmentation are going to get a round product, and then the profile is adjusted. There's different softnesses of the gel, which the gel is a cross-linking, and it keeps it together. And so the days of the old implants, like in the 60s, 70s, was a lot more of a runny kind of a gel, and so if the implant shell ruptured it, the silicone just kind of ran out, but your body always contains it, okay? Keeps it in this guard bag around it. But the newer implants, if somehow they were to rupture, you won't even know it. I mean, the implant is basically almost form stable, similar to their term called the gummy bear technology. Cut a gummy bear in half, 2 pieces, stay like that. So these implants are made for longevity, softness, feel, and look. And just the catalog we have now of implants has been dramatically improved over the decades. Another one is DVT prophylaxis and body contouring, and this is a safety issue. This is my paper that I published in 2015, and it was in the Aesthetic Surgery Journal, which is our main journal for the world. So very honored to be featured in this issue. I got editor's choice for our article, and it was on anticoagulants and plastic surgery. At that time in plastic surgery, there was this thing called DVTs, which is, we'll talk a little bit about it, but it's a life-threatening issue if it becomes a pulmonary embolism, where that clot travels from your legs or other parts of your body, goes in your lungs, and you can actually die. So for cosmetic surgery, we want to decrease risk of that complication specifically after significant body contouring, which has a higher incidence. We're not going to go to details of that. If you want the details, go read my paper, please. But we studied anticoagulant therapy in our practice. Historically, my senior partners were using a medication called Lovenox, and that was done after surgery to reduce the risk of blood clots while the patients were recovering in bed and just kind of, less mobile. And then when a medication called Xarelto came out, it's a whole different class of new anticoagulant. It was like changing the game on the anticoagulant therapy. And so I brought it into the practice. We started transitioning from Lovenox to Xarelto. And then another version of that class of medications called Eliquis came out the following year, and I brought that into practice, and then I did a study on all 3. And long story short, Eliquis is by far the superior anticoagulant, decreased risk of blood clots, pulmonary embolisms. It has a much lower safety profile as far as complications associated to the alternatives like Lovenox and like heparin and stuff like that. So very proud of this paper. It is one of the first papers on those medications, one of the large series kinds. I'm about to do basically a update. Now we have another I think almost 8,000 patients to include the study, which will make it significantly much more powerful and the largest study of its kind comparing these anticoagulants. So stay tuned for that. I'm bringing that back in probably later this year. So just kind of talking about the physiology, what a DVT is the blood clots in your veins. They typically are going to have in your legs. So women who have cosmetic surgeries like a tummy tuck, high volume liposuction with other procedures, people aren't moving around, and what happens is that the blood flow in your legs kind of slows down, and then it will clot. And so what can happen is you'll get localized symptoms, which is swelling and pain and maybe even some more prominent swelling as your leg goes up. And what the feared complication is that clot breaks off and goes up into your heart pumps it into your lungs, and then it gets stuck. And then when it gets stuck, what happens is you can't ventilate anymore. You can't transfer the CO2 into the air and get the oxygen out of the air into your blood. And then what happens, you get hypoxic and you die. So very, very, very much dreaded complication. No one wants that. There's camps of surgeons that are like, I'm not using it anyway. I don't want to use it. I don't want to have that risk of bleeding after surgery. We have like a hematoma. And I would say there are two camps of surgeons, ones that use DVT prophylaxis and ones that do. And I am the one that does, because I don't want my patients to die. And I'd rather take the risk of having that very, very small risk of a blood formation after surgery, where that's called the hematoma, and I just have to drain it out in a surgery after when that happens, versus having someone go to the hospital and dying. Like that to me is just not worth it. The incidence of hematoma after prophylaxis just is really low. So if you're considering abdominoplasty and other contouring procedures, definitely have this conversation with your board-certified plastic surgeon. Am I going to need DVT prophylaxis? And if I do, what kind are you going to use? And so if you want to kind of go down that rabbit hole, look my paper up. Another advance in technology is called LongLasting and local anesthetic. And the medication is called Exparel. And this came out in 2012 when I came out of residency. And once I saw it come out, I grabbed it immediately. I thought it was going to be a game changer for outpatient surgery. So I wrote a paper on it associated to abdominoplasty specifically. It was one of the first papers ever talking about plastic surgery with the use of medications. This is my first paper. I was very, very proud of it. Again, it got editor's choice in the Aesthetic Journal. And we found a lot of cool things with it. So previously, we were using a medication that was delivered into the abdominoplasty area called a pain pump. It's an on-cue pain pump. And what it does, it would kind of leak this local anesthetic like lidocaine or Marcaine from a little bulb that had a catheter, and it went through your skin and went into the area of the surgery, and it would just kind of trickle it out. Like those irrigation systems you see in the gardens. Slowly trickle out over the course of like 2 or 3 days. The problem with that stuff is that's an extra drain, kind of a tube coming out of you. It will get stuck, it will get clogged, super pain in the butt, get infections sometimes with it, because it's another thing coming out of you. And that's what I was using in residency. That's what that's what we had for a little bit better pain control after surgery. When this medication came out, it was basically as a game changer. So now it came in a liquid form. You put it in a syringe, and during surgery, we actually inject it into the soft tissue, and it decreases pain in those areas. And the technology, just keep it simple, is basically like this. It's called a liposome. It protects the molecule of the anesthetic, like Marcaine. And when you inject it in the soft tissue, the body sees it as, for the most part, normal, and it protects that molecule Marcaine. So as it kind of sticks around, your body starts kind of, start chewing that liposome up, and it removes it, and the molecule pops out, and then it creates the effect on the nerves, which is an anesthetic effect. So you get this delay of release of that medication, and that pain control that you get from the local anesthesia effect lasts for about 2 or 3 days. So that was a game changer for us. And so no more on-cue pain pumps, no extra catheter. Patients were so much happier. They had a faster recovery because they felt better. They're walking sooner. There's no risk of infection because it's just a local anesthetic that we inject during the surgery. So that has really changed our practice. We use it almost exclusively. And then everybody else started hearing about it, and then started getting other specialties. Now it's in orthopedics, it's in OB-GYN, it's in derm, it's in colorectal. It's like in every surgical specialty. And so if you're having any kind of surgery, and it's somewhat painful, you definitely ask your surgeon, is Exparel available? And the answer is typically yes. This is kind of what it looks like. It's called Exparel. It's just a vial, just a solution. And this is an illustration from my paper. And we were specifically trying to maximize the effort of this medication and do kind of a nerve block technique. And so, here are the nerves associated to the abdominal wall. And my injection technique is specifically targeted at these nerves to decrease the pain and have a longer lasting effect. You don't want to just kind of throw it everywhere. It's kind of a waste of the product. You really want to kind of focus where the nerves are and knock those down. The next thing that's really come into play the last like 5 years is skin and soft tissue tightening. And this has really been a huge advance in technology for body contouring. You know, there's an aspect of our skin that as we age, we lose elasticity. We get stretch marks sometimes in different areas, depending on weight loss, weight gain, pregnancy, blah, 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 blah. And when you have extra skin, you have stretch marks, you know, it's really limited amount of skin tightening you can get or the soft tissue tightening you can get. That's just a reality. You know, our options were just, you know, cut it off. And so, but now we have this intermediate kind of treatment where you have okay skin, it's, you know, has some elasticity left in it, not a whole lot of stretch marks, and then now we can add an energy to the soft tissue or the skin. And what happens is as we heat soft tissue of the human body, it shrinks. And so it's different forms of technology. Now we have, you know, different energy forms. Most common form for body contouring, specifically the plastic surgery, is going to be some kind of radiofrequency therapy. This energy, you know, I would say the most common, most dominant energy technology used in surgery, and that's what I want to limit to is surgery, is called BodyTite and Reuion. So personally, I used BodyTite for a few years until I got my hands on Reuion. BodyTite, you know, I'm not going to go in, we can kind of go into that different conversation in a lecture series. BodyTite is basically a bipolar energy distribution. It really only targets the dermis of the skin. So it's limited to just the skin tightening. So the skin will tighten up a little bit. Come into Reuion, which I started last year. The Reuion is a game changer. Now it tightens not only the skin, but it tightens the soft tissue, the deeper soft tissue, the tissue in the fat, the fascia in the fat. I mean, it just really has a much better, you know, soft tissue tightening versus just skin tightening. And so I'm gonna kind of just show what Reuion is. So it basically is a plasmic technology. The radio frequency energy is the ignition source. Gas is put through this little tube and it lights it up and it turns into plasma. And so have you ever seen those toys at home? Maybe you play with them a long time ago. I'm a little older. But it's like those crystal balls and had like the lightning thing inside, and you could touch the crystal ball and the lightning would kind of go wherever your fingers were. Same concept. What is that lightning is doing is trying to ground, so it goes to you. And so same thing with this is that, you know, the lightning is putting into you, into the soft tissue. We've done liposuction already. All right, now we have this dead space where you have the space where you remove the fat. We put the gas in, the gas kind of fills the space up. You add the energy and boom, the energy starts grabbing anything it can ground to. So it's grabbing the collagen within the fat tissue. It's going to grab the dermis, it's going to grab the fascia. And then what happens is everything starts shrinking down collectively. So you get a much better overall soft tissue shrinkage with this technology in my experience. And I've seen it clinically. You know, patients have a much better result in my experience versus the BodyTite technology. So next one is called TXA, and this is called tranexamic acid. We call it TXA in surgery. This is relatively new to plastic surgery, probably in the last, like I would say, maybe 3 to 5 years. It's relatively new to our specialty. It's pretty much rampant in orthopedics and some other specialties. I say orthopedics is probably the one that used the most. The physiology is interesting. What we think it does is kind of inhibits the conversion of plasminogen to plasmin, which is part of the cascade of breaking down clots. And you don't want fibrin, you want fibrin to stay together, but you know, the idea is that enzyme interruption decreases the breakdown of clots and causes bleeding. So really cool stuff. We don't know, if you look at the studies, we don't really know how it works, but it works pretty amazingly well. And there's really no clear literature for plastic surgery, like the dosing, like do you put it in locally, do you put it in through the IV, you know, and then you have this counterbalance. If you're doing body contouring surgery and using prophylaxis to, you know, decrease the risk of clotting, and then you're adding this other medication that increases risk of clotting, like which one do you pick, right? So, you know, that's, I would say most surgeons now are using some kind of form of TXA, especially with facial surgery, you know, here and there with other contouring surgeries, not so much tummy tuck stuff, but it's a really cool medication. It comes in injectable form, so most surgeons are going to use it as an injection. We actually inject the soft tissue. It's can be done in the IV too. So during the surgery, you can have the anesthesiologist put in the IV, and you get more of a systemic effect. Me personally, I do it more locally. So I kind of, wherever I'm doing the surgery, this is where I put it. I use it almost exclusively for eyelid surgery, brow surgery, and if I do a brow lift, some breast surgery. and it makes a huge difference in the bruising. And it just, I think it's been a game changer for me, for facial surgery specifically. Okay, so that's it. Those are the 5, I call them pro tips related to the most recent innovations of plastic surgery. Hope you learned something. As always, drop me a comment in the comment section below. Send me a message, appreciate it. Thank you for liking and subscribing. Please keep following me and stay tuned for more.